more topics to be done. Okay, so development of female reproductive organs and related disorders. First, you have cervical cells of Mullerian eminence. So, first we talk about imperforate hymen, which is failure of distinguishing of central cells of Mullerian eminence, leading to imperforate hymen. Mullerian eminence will be there, and they do not get disintegrated. Upon menarche, the blood gets collected behind the hymen. This is cryptomenorrhea, leading to hematocolpos because the blood fills the uterine cavity, and cryptomenorrhea will occur. Neglected case leads to blood collection in fallopian tube, which is hematosalpinx. Okay, here in uterus it is hematocolpus, then it is hematosalpinx. Presenting age is around the age of 14 to 16. They come with lower abdominal pain and primary amenorrhea. Urinary symptoms will be frequency, dysuria, and retention will be there. Abdominal examination, you'll find suprapubic swelling, and vulval inspection, you'll find tense bulging of bluish membrane, which is the transverse vaginal septum. Then on rectal examination, you'll find a bulged vagina. Then also investigations, you do ultrasonography, and treatment is cruciate incision made in the hymen. You perforate the imperforated hymen. Spontaneous escape of dark tarry colored blood will be there, and you provide antibiotic therapy. Then development of fetal reproductive system. First of all, the Y chromosome is absent, therefore STRY gene is absent, therefore gonads of ovary will be formed by 8 to 10 weeks. Thank God I noticed that my stream was not happening. So yeah, we are talking about imperforate hymen, which is disintegration of central cells of Mullerian eminence leading to imperforate hymen. Hymen is not perforated. Upon menarche, blood gets collected, cryptomenorrhea, hematocolpos will occur, and hematosalpinx. Okay, they are 14 to 16 years old. They come with lower abdominal pain, primary amenorrhea, frequency, dysuria, and retention will be there. Suprapubic swelling will be there. Vulval inspection, you'll find tense, bulgy, bluish membrane, and rectal examination, you'll find a bulged vagina. Ultrasonography is the diagnosis, and treatment is cruciate incision. Spontaneous escape of dark tarry colored blood will be there, and antibiotic therapy should be started. Then development of genital tract. Y chromosome is absent, STRY gene is absent, gonads ovary will be formed by 8 to 10 weeks. So by 8 to 10 weeks there will be formation of ovaries. Sertoli cells will be absent, Leydig cells will be absent, testosterone will not be converted into dihydrosterone. So Sertoli cells are absent, therefore Mullerian inhibiting factor is not there. Mullerian duct grows and forms the internal vagina in females. Fallopian tube, uterus, cervix, and upper 2/3 of the vagina. Then testosterone is absent, so Wolffian duct regresses. Remnants of Wolffian duct will be present as this. They will be present as E-poop horn and Gardner's duct. Okay, and Epiophoron, parapooperon. They form that one, that structure they'll form. Okay. Then testosterone is not converted to dihydrotestosterone. In absence of dihydrotestosterone, external genitalia of female will be formed. So genital tubercles will form the clitoris, genital swelling will form the labia majora, and genital folds will form the labia minora. So dihydrotestosterone, exactly, it's not formed. Okay, tubercle, it will become clitoris, swelling will become majora, and folds will become minora. So embryonical structures, you have labiosacral swelling will become labia majora and scrotum in male. Urogenital folds will become labia minora and ventral aspect of penis in male. Genital tubercle will become clitoris and penis in male. Urogenital sinus will become urinary bladder, urethra, except the navicular fossa in male, but urethral and paraurethral glands, prostate gland in males, vagina in lower 1/5, prostate utricle in males, Bartholin glands and bulbourethral glands in males. Okay. Paramesonephric is female, so it will become uterus, cervix, fallopian tube, upper 3/5 of the vagina. And it also becomes hiatus of Morgagni. And in males, it will become appendix of testis. It is a remnant. Whereas normal mesonephric, which is the male part, will become ductus epididymis, ductus deferens, and seminal vesicles. Here it will become epiophoron, parapooperon, and stuff. Ductus efferens and paradidymis it will form. Undifferentiated coxia, undifferentiated gonad will become ovary. Here it will become testis. Cortex will be ovarian follicles. Here it will be seminal tubercles. And medulla will be rete ovary, whereas here it will be rete testis. Then gubernaculum, it will be ovarian ligament and round ligament in uterus. Here it will be gubernaculum of the testis. Okay, and it will become hymen and seminal colliculus. So Mullerian duct anomaly. Okay, so it is diagnosed by hysterosalpingogram. Investigation of choice is MRI and 3D ultrasound and laparoscopy. So uterus difference, it is a condition where there is failure of fusion of whole length of Mullerian duct resulting in 2 uterus, 2 cervix, and 2 vagina. Okay, by cornuate uterus only the lower part of the ducts fuse, leaving cornua separated. So there is always a single vagina, but there is 2 uterus. Okay, that is uterus bicornus unicollis. But another type is vagina is fused, cervix also is in one, single vagina, 2 cervix, and 2 uterus. That is bicornus bicollis. Cornis collis. Okay, then we have septate and aseptate uterus, outwardly normal but contains a complete or incomplete septum, reflects a failure in breakdown of the walls between the 2 ducts. Then you have acornuate uterus, wherein the fundal bulge of the uterus does not develop after fusion of the ducts, so it will become a flat topped uterus, whereas normally it should be like this. It will become a flat topped uterus, but complications I'm not sure. Unicornuate uterus is it does not represent a defect of fusion of the duct, rather that one of the duct is completely absent. Okay, it's completely absent from birth, and so there is only one fallopian tube. Okay, completely absent, one fallopian tube. Uterus, cervix, and vagina appears to be normal and are only half of the fully developed organ. So WHO classification of Mullerian anomalies: you have Mullerian agenesis, you have unicornuate, type 3 is didelphys uterus, type 4 is bicornuate uterus, type 5 is septate uterus, type 6 is arcuate uterus, and type 7 is DES related abnormalities or T-shaped uterus. So management. In management, you have unification operation. It is indicated, and otherwise unexplained cases of infertility. If it is there, more than 3 abortions, if it is there, then you have to do like a unification operation. Bicornuate and didelphys uterus, you do unification surgery. Septate uterus, you do a hysteroscopic resection of septa after inducing endometrial atrophy by GnRH analog therapy. Then remnant of Wolffian duct, part of the Wolffian duct, and remnant in female. We can write. Pronephros is identity of Morgagni or cobalt tubercle. Mesonephros, caudal and cranial lines are there. Paraferon and oophoferon. WD proper will become Wolffian duct proper will become Gardner's duct. Okay. Then we move on to one second. Okay, sorry. We move on to puberty, adolescence, and related gynecological problems. So, puberty is a gradual development of secondary sexual character. Gradual development of secondary sexual characters. Age of puberty in girls is 8 to 13.5 years. 8 to 13.5 years. Factors you have genetic, nutritional, body weight, psychological state, and social and cultural background. All of them are factors affecting the onset of puberty. Okay. Morphological changes, you have Tanner and Marshall's 5 important physiological changes. So you have thelarchy, which is breast, pubarchy, and then you have adrenarchy, and precaudal, and then menarche, which you have done here also. So growth spurt is the first sign. Then you have thelarchy, then you have adrenarchy, peak growth in height weather, and finally you have menarche. So sequence in male, you have testicular growth, which is the first sign, then penile growth, then pubarchy, then peak height velocity. So this of course is a very normal feedback loop. Hypothalamus, GnRH, pituitary, SLH, FSH, ovary, estrogen is produced and it promotes follicular development, it stimulates growth hormone. This acts as a negative feedback. Estrogen has a negative feedback to the FSH. Endocrinal changes. So until puberty, there is a negative feedback on the hypothalamus. Upon onset of puberty, negative feedback is abolished. Significant increase in pulsatile release of GnRH. So growth height is due to growth hormone and estrogen, insulin growth factor 1, IGF-1. Menarche is onset of first menstruation in life. Age is between 10 to 16 years old. Peak time being 13 years and occurs 2 to 6 years after onset of puberty. So menarche denotes there is intact hypothalamus, pituitary, adrenal, ovarian axis. There is functioning ovaries. There is presence of responsive endometrium to endogenous ovarian steroids and presence of patent uterovaginal canal. Okay, patent uterovaginal canal. So following menarche, regular menstruation may take about 2 years. So disorders of puberty, you have precocious puberty, delayed puberty is there, menstrual abnormalities is there, and others are there, which is infection, neoplasm, hirsutism, etc. Menstrual abnormalities, you have amenorrhea, menorrhagia, dysmenorrhea, delayed puberty, of course precocious puberty, early puberty. Then Tanner staging of breast and pubic hair in girls. This is one of the most common 5 markers they ask. Stage 5 stages of cancer of breast and pubic hair. So genuinely I'm just going to just do this and put it over there. So let's see, stage 1 is puberty. There is elevation of papilla only, then there is breast bud and papilla will be slightly elevated and side of labia areola begins to enlarge. Okay, between 9.8 years. Okay, then there is further enlargement of entire breast tissue. There is secondary mound of areola and papilla will be there. Then it will be projecting above the breast tissue between 12.1 years. Then areola will regress to general contour of the breast, that is 14.6 years around. This is how the staging is. So stage 1 is pre-puberty, there is elevation of papilla. Stage 2 is breast bud and the papilla will be slightly elevated and side of labia areola will begin to enlarge. Stage 3 is further enlargement of entire breast tissue is there. Stage 4 is secondary mold of areola and papilla will be projecting above. Secondary mold will be there and areola will regress. Okay, unfortunately, I have to stop. So I'll continue.